So actually, older adults experience depression a little bit less often than younger and middle-aged adults, but it's still a pretty common thing. What we call major depression or clinical depression is suffered by about 5%, about 1 in 20 of older adults at any one point in time. So if you take everybody who's coming into a doctor's office, in a primary care office, about 1 in 20 have major depression at that point in time. Another 5 to 10%, so another 1 in 10, will have had depression at some point in the past that's now doing better. And then there are people who suffer from depressive symptoms that are not severe enough to qualify for what we call major depression or clinical depression, but that are still causing them some trouble in their lives, some emotional distress, or maybe affecting their functioning a little bit. And that can be up to 15 or 20% of people can have at least some symptoms of depression without having the full clinical depression. And absolutely. Every time an older person has contact with a healthcare provider, it's an opportunity to pick up or to not miss something important going on like depression. Depression affects people's morale, it affects their emotional well-being, it affects their functioning on a day-to-day basis. Depression also puts people at risk for suicide, and we know that most older people who kill themselves suffer from depression, and most of them saw some kind of healthcare professional sometime in the few weeks before they died. So in order to prevent suicide among older people, which is something that we can and need to do better at, we need to have everybody who works with older people be alert for the signs of depression and to ask about it. Absolutely, anybody who's in the healthcare profession can evaluate for depression, and aside from looking and observing the person to see whether they appear sad or emotionally withdrawn or irritable or quick to anger, or whether they talk about not enjoying things the way that they used to, if somebody, a pre-hospital provider, wants to ask about depression, the simple question, have you been feeling depressed or down? Have you lost interest in things? Those couple of questions are really all it takes to open up the doors to talking about maybe other symptoms that the person might be suffering from.
So when we're dealing with patients that, elder patients that may have psychological issues, there are certain things that do change. And I've already spoken about a few of those in terms of our exam of the patient, our interview of the patient changing, and trying to build that trust relationship and getting true answers to our questions. It certainly also changes our physical exam of the patient, making sure that there is nothing physically wrong with the patient. Are they malnourished? Doing a good physical exam to determine if their nourishment is where it should be. Are they taking their medications, as I mentioned earlier? Checking that they have a pill-taking strategy, checking their pill bottles to see how many pills should be left in the bottles based on their prescription and when it was filled. Trying to make sure that they are taking them as prescribed. And there's two sides to that. Are they taking too many or are they taking too few? There certainly is opportunity with the number of medications that we see older adults on for them to try to overdose or abuse substances that are prescribed to them for medical conditions. So certainly we need to keep an eye on that. In addition to that, looking at the environment, making sure that there is food in the refrigerator, making sure that there is not dirty, food rotting laying around. Is the environment cluttered? Are there newspapers piled up? Are there animals in the house that aren't being properly taken care of? The old cat environment where nobody's putting out the litter, and there's basically cat feces or urine throughout the house. Are they taking care of their own needs? Do they look like they've showered? Do they look like they've cleaned themselves? Is their hair done? Are they dressed appropriately for the weather? All of these things can lead you down the road of potential depression and or suicidal ideation, or just general neglect of themselves, certainly. And all of those things also can be involved in patients that are in caregiver environments. It certainly may not be the caregiver that is abusing the patient. It may be the patient that is being neglectful of themselves. So we have to be careful not to go down that road of abuse, but to objectively report what is found, because it may end up that the caregiver is trying everything in their power to provide what that patient needs, and the patient is simply neglecting themselves because of depression or suicidal ideation.
Mental hygiene arrest is kind of a terrible term. Mental hygiene refers to the laws in New York State that have to do with caring for people with mental illnesses, and they're very old, and that old term, mental hygiene laws, is what's used. And then there's that word arrest, which sounds like we're giving somebody a criminal record, which it absolutely is not. What a mental hygiene arrest is, it's not an arrest, it's not a criminal charge. What it simply is a way in which the police can bring someone to psychiatric emergency services in one of our emergency departments and do that even against the person's will, and they're able to do that when there's cause for concern that the person may be dangerous to themselves or dangerous to people around them. So what we can do as healthcare providers is we can call the police and tell them we have reason to be concerned that a person, a patient of ours or somebody that we know is dangerous to themselves or others. And that may include if they're making statements about suicide, but also may include people who are simply not taking care of themselves in a way that's even minimally safe. Someone who's not eating, who's not drinking, who's not going out to get basic necessities of life, that's dangerous to themselves, even if they don't mean to be dangerous to themselves. And so what we can do is call the police, tell them of our concerns, and recommend that they evaluate the person for a mental hygiene arrest. And then when the police go and investigate the situation, if they agree that the person is at risk for dangerousness, then they can bring that person to the emergency department and let the healthcare professionals there do a psychiatric evaluation and figure out what's going on.